Hi, this is part two of our lecture on microbial infections of the skin. I am your instructor Kwame Shen. Part two will focus on viral infections, fungal infections, and some skin infections that are caused by parasitic organisms. And so the first infection that we'll look at is smallpox. Smallpox is caused by smallpox virus or variola virus, which belongs to the group Orthopox viridae, the family of Orthopox viridae. So we say smallpox, an example of Orthopox virus. It's transmitted through the respiratory route. There are two forms of it, variola major and variola minor. And the major forms of it was the most mortal, most fatal, and the fatality in terms of infant death was about 80%. Symptoms are distinctively you have this progressive skin rash, the pustula, that forms about 10 days. You have incubation period of about 7 to 17 days, and then you have fevers and but the most distinct characteristic in terms of the symptoms is the formation of the skin rash due to the replication of virus in the epidermal layers of the skin. In terms of the effectiveness of vaccines and Exhibit A, in terms of the benefits that we have actually gained from the use of vaccine, smallpox is one of the important infectious diseases that was eliminated in 1977. So 1967, the World Health Organization launched this very intensive plan to eradicate smallpox, and in a period of 10 years, through massive and widespread immunization and surveillance, the disease was eradicated. In 1980, the World Health Organization declared smallpox as eradicated. And so it remains among the most notable and profound public health successes in human history. More recently, however, we've seen an increase in cases of monkeypox. I mean, the last outbreak was in 2003, and it's also caused by an orthopox virus, specifically the monkeypox virus. And the symptoms are very similar to that of smallpox, but it remains mainly a zoonotic infection in that it's maintained in the wild, in animal populations. We've seen that it can be transmitted from animals to humans, but thankfully we haven't seen a jump from human to human yet, so we don't have much of a public health issue on our hands. But the other good news is that the smallpox vaccine offers protection against the monkeypox disease as well, so that's great. Then chickenpox or varicella, it's caused by the herpes virus, varicella-virus, but more specifically, the human herpes virus 3, HHV3. So varicella zoster, also known as chickenpox, applies in this case, and it's transmitted by respiratory droplets to the respiratory tract. Once it gets into the body, in about 2 weeks, it becomes established in the skin. And when it's in the skin, within 3 to 4 days, you have the formation of the skin lesions, the vesicles, with pus. It then ruptures and forms a scab. And then these lesions, you commonly see them in the face, the throat, the lower back, the chest and shoulders, and the likes. There could be serious fetal damage in terms of fetal during pregnancy, the early part of pregnancy. And so It's something that is really looked out for at that stage of pregnancy. Occasionally, you may have a complication that will result in a symptom that is called Reye syndrome. Reye syndrome is a complication of chickenpox and influenza and other viral infections, and it's very fatal. At least it was fatal. It was caused about 90% fatality in those that got infected. We've been able to reduce the fatality rate or death rate to about 30% now. And symptoms it include persistent vomiting, brain dysfunction, and survivors are often left with lingering neurological damage. It occurs almost exclusively in children and teenagers. There has been a correlation between increased use of aspirin and increased incidence of Reye syndrome. And also, aspirin is often used to treat the fevers that are associated with chickenpox. HSV 3, like other herpes virus, will remain latent in the body and only become reactivated again under stressful conditions or in immunocompromised people. And then you have shingles or herpes zoster. We've talked about varicella zoster, which is chickenpox. Now, shingles is just a different expression of the presentation of the human herpes virus once they become reactivated. And symptoms are very similar to that of chickenpox, except that the symptoms are localized in specific areas of the body, most commonly around the waist region. And treatment, cyclovir has been very effective in treating it. So for varicella zoster or chickenpox, in the initial infection, you have the pus. Once the virus gets into the skin, 3 to 4 days, you have these vesicles forming, pus gathering, and then it's breaking. And for most people, it self-resolves. But what happens is that the virus then gets to the dorsal root ganglion near the spine, and once it gets there, it remains latent. So it embeds itself into the genome of the cell, and the immune system is not activated. However, later on in life, this could be decades after, when the individual is immunocompromised, there's some hormonal changes, or for whatever reason, it's reactivated. And once it's reactivated, the virus will then move down the peripheral nerve to the peripheral part of the body and gets to the skin. And so you have it presenting in the skin like that. And so shingles are usually limited to one side of the body because the nerves are unilateral. But it may also result in neural damage and even paralysis in some cases. Then you have the herpes simplex virus, which causes herpes simplex. So you're talking about human herpes virus 1 and 2. So human herpes virus 1 is transmitted also by oral and respiratory routes. So oral and respiratory routes. And usually in the infancy, you have about 90% of the population in the United States that are infected with it. The symptoms are subclinical, but you may have cold sores and some fever blisters in some cases. Cold sores are often confused with canker sores. But there is a difference. Canker sores are associated with stress and menstruation. But the cause of canker sores are not known, and canker sores also occur in various parts of the body, different parts of the body. Now, if you look at what the main characteristic in terms of the cold sores where they are formed. You have them mainly around the outer margin of the lips, and it comes down to where the virus remains latent. The virus, the site of the latency is in the trigeminal nerve. Okay. So that's where it remains latent. So once it's reactivated, it travels to the mouth, the areas around the mouth, and that's where the spores present. And so it remains in the trigeminal nerve, and then you have a reoccurrence due to hormonal changes or emotional changes or any other external condition that may cause that. It's in skin, and in certain instances, you have transmissions in the skin that are very common in wrestlers because they have to have physical contact with each other. You have some form of transmission of the virus in that regard, and that is known as herpes gladiatus, that form of herpes. You could also have infections in healthcare workers due to some pricking accidents on your skin, and which will cause a transmission of the virus to their skin, and in that case you have the herpetic whitlow. And then you have herpes simplex virus 2, which is mainly transmitted through sexual contact, and so the usual cause of genital herpes, but in that case it remains latent in the sacral nerve ganglia, and so not the trigeminal nerve but the sacral, because it's in the organism is introduced in the lower part of the body. Both can cause encephalitis or inflammation of the tissues that surround the brains, and in those cases it's highly fatal. Acyclovir is also very effective in treating this. Then you have measles. Measles are very highly contagious. So if you have one person who has a measles infection in a closed room, you could have up to 90% of the people who are not immune who would become infected. So very, very contagious, more contagious than COVID. Infected people can spread the measles to others from 4 days, even before they begin to show the rash, which is a characteristic symptom of the infection. And so measles is caused by measles morbillivirus through respiratory droplets. They could also through skin-to-skin contact or saliva, through kissing or mother to baby, or contaminated surfaces or fomites could also be sources of transmission as well. And the symptoms include high fever, the cough, running nose, and then clinically, one of the most important diagnostic feature will be the complex spots. So these are small red spots with central blue-white specks 2 to 3 days after the onset of the symptoms, and the measles rash will appear 3 to 5 days after the onset of symptoms. There is a vaccine that has proven very effective until recently, when a lot of parents in California have started not vaccinating their kids, and we've seen outbreaks of that in California and other states as well. But the MMR vaccine, which is a combination of mumps, measles, and rubella live vaccines, have proven very effective. We also have a different from the measles caused by the rubella virus, called the German measles or rubella measles. It's also transmitted via respiratory routes. It's just that it's a milder form of the rubella disease. So the measles, the classic measles caused by morbillivirus is described as rubella. And then the German measles is rubella. The symptoms are the macular rash, small red spots, and a light fever. There could be complications that could lead to deafness, cataract, and heart disease, and autism, and even death. But the people who are most at risk are pregnant women. So if pregnant women have infections, it could lead to congenital rubella syndrome, which could lead to some of these complications. We have the rubella vaccine administered 3 months before after the date of conception will prevent the infection in the newborn. The other viral rashes as well, you have the fit disease known as erythema infectiosum, which is has a distinctive slap cheek facial rash. So as you can see in this insert here, but it slowly resolves by itself. You have about 20% of people who are asymptomatic. It's caused by the human parvovirus B19. You have the roseola, the human herpes viruses 6 and 7, and they are characterized by high fever and rash that may last for a day or two. It's mostly transmitted through saliva in most adults. So kissing will be one of the common ways, and that's how the rash presents for the roseola. Then you have the hand, foot, and mouth disease, which are caused by a number of viruses, and transmission is through the mucus or saliva of infected people. You have fever, you have sore throat, and then you have a rash. And in this case, as you can see on the foot of the sole of the foot of the person, you see the rashes there. There are fungal infections that are also important skin diseases. So you have skin and nails, and fungal infections are called mycosis. You have the cutaneous and the subcutaneous. The cutaneous are limited to the epidermis, and that the living tissues are actually not involved in this case. And so for cutaneous mycosis, it colonizes the hair, the nails, and the outer layer of the epidermis, and so they are called dermatophytes. So they include ringworm infections, so tinea infections, tinea capitis, cruris, pedis, and unguium. It all comes down to which parts of the body that they are infected. Then you have the deeper ones. So this is an example of athlete's foot, or tinea pedis, ringworm of the feet. And the subcutaneous, these are more serious. You have fungi that go beyond the stratum corneum into the subcutaneous layer, the living tissues. And a good example in terms of the common one that we see is sporotrichosis, which is caused by the fungi Sporotrix skinki. And this is how the rash appears for sporotrichosis. You also have a more common one, Candidiasis, which will result from results after the use of a broad spectrum antibiotic or in immunocompromised individuals, where the immune resistance is reduced and there isn't much microbial antagonism because the normal microbiota have been eradicated by the broad spectrum antibiotic. And so in those instances, you would have an outbreak of candidiasis, or oral thrush, and most commonly caused by Candida albicans. There are other species that could also be involved. And so Candida albicans will cause oral thrush in newborns and may also cause vaginitis as well. Parasitic infections of the skin. We'll talk about scabies, which is caused by mites. Its scientific name is Sarcoptes scabiei, and it's transmitted through the bite of the mites. Once it lays its eggs under the skin, the mites will continue to metamorphosize in the skin, and that's how the symptoms present. Mites are transmitted through personal contact, including sexual interactions, And the symptoms include itching and inflammations. Ivermectin is very effective in treating them. And then you have pediculosis, which is caused by lice infestation through personal contact as well, sexual contact as well, poor personal hygiene, crowded areas such as refugee camps and homeless encampments. It's a very common place to have these outbreaks. And it's also characterized by itching that can result in the secondary bacterial infections. And permethrin is also effective in treating them. So that brings us to the end of our lecture on infections of the skin.